Breast augmentation is a commonly performed plastic surgical procedure, and it is used to add volume to the breast. Implants these days are well made, and the ones that we most commonly use are made of silicone. They're composed of an outer shell which can be smooth or have texturing, meaning it is slightly rough to the touch, and inside the implant there is a more viscous silicone gel. Implants vary in size, the composition of the shell, the amount of firmness of the implant itself or the viscosity of the gel inside, as well as the shape of the implant, which can be round or can be what we term tear-shaped or anatomical. Anatomical implants are used to more naturally mimic a native breast shape. Most commonly, implants are inserted through an incision in the breast fold, and they can be placed either under your pectoralis or pec major muscle, or they can be placed between the muscle and the breast gland itself. At your consultation, we discuss the plane of placement of the implants and make a recommendation as to what would be most suitable for you. Breast implants are mostly performed in patients with small breasts that desire volume addition. It is important to note that asymmetry of the breasts or asymmetry of the chest wall are magnified during a breast augmentation procedure, and the nuances of this need to be discussed with you before undergoing any surgery. In particular, implants carry a number of risks. The most common involve the formation of scar around the implant, which can be hard or painful, and we term this capsular contracture. There can be movement or displacement of the implant. There can be animation or movement as the pectoralis muscle moves in relation to the implant itself. And then there are some very rare risks, such as the formation of breast implant associated anaplastic large cell lymphoma, which is a long and complicated name referring to a late onset form of cancer which occurs around an implant. This is very rare. It is usually associated with highly textured implants which have been taken off the market, and it is usually completely treated by removing the breast implant with its surrounding capsule. Some women complain of a constellation of symptoms after breast implant placement, referred to as breast implant illness. Patients with breast implant illness report a constellation of symptoms such as fatigue, lethargy and tiredness, and some people also think there may be a link between the development of autoimmune diseases and the placement of implants. However, there hasn't been any conclusive evidence of this in studies. Even so, it's important that you're aware of the risk of breast implant placement, even if some of these risks are remote or lack significant scientific proof. Breast augmentation remains one of the most commonly performed plastic surgical procedures and is one of the most powerful ways to reshape and add volume to your breast.